I had a very nice young lady yesterday I saw, and she had a very simple question for me, and it was, Doctor, why am I anxious? And I said, well, what do you mean exactly? And she was referring to her life, and she said, Doc, when I go to bed, the room's quiet, suddenly my brain turns on. It says 10:30, 11, I'm ready to sleep. I've had a busy day, and I start thinking about my health, my job, my money, my family, and something uh, that you told me 3 years ago when I came in for iron deficiency, and I start thinking about what could happen tomorrow, and my heart starts pounding. I feel a tightness in my chest at times, and I feel like I can't take a deep breath. I wonder, is this anxiety? Uh, and I start worrying. So it's a common issue that I've been asked often. So I figured it's definitely worth talking about. Is this anxiety or is something medically going on? So let's talk about it. Anxiety is not abnormal. Anxiety is a part of our body's alarm system. And if you're walking through the woods and suddenly you saw a bear and your heart rate is not increasing, your breathing is not changing, your muscles are not tensing, and you're not becoming alert, and the flight or fight or flight response does not kick in, then you really have a problem, and the bear may eat you. At night, you're in your bedroom in a perfect environment that you've created for yourself, and this is really your time to relax. However, during the day, your brain has been constantly distracted. You've been working, you've been driving, talking to people, answering phone calls, taking care of children, solving problems, and at night, the emails stop, TV's off, and there aren't that many questions anymore, and the house becomes quiet. And suddenly there's nothing distracting you from you. What I mean is your own thoughts. So then, when the brain may start reviewing everything that happened during the day and plan and imagine the things that may happen tomorrow and tap into memory of the things that happened in the past, this becomes a worry that leads to another worry, and ultimately you lie in bed wide awake. And this, unfortunately, is a vicious cycle. Uh, it will keep you from getting rest, and worried individuals don't sleep. And as a result of that, the next day you're exhausted, then you're more anxious, and this can go on as a cycle, night after night after night. And then you start taking caffeine, nicotine gum, certain medications. Some people take alcohol, some people take stimulants. And before you know it, your memories of the things you can't do anything about and your nightmares of tomorrow through your imaginations that you can't do anything about are terrifying you when you're supposed to be resting. So the question becomes then, are there medical issues that we need to talk about? Do you have so called thyroid disease that leads to tremors or rapid heart rate? Do you have low blood sugar that causes anxiety like symptoms like shaking and sweating? Do you have respiratory issues that cause shortness of breath? Are you taking too many stimulants to keep up and you're drinking too much to rest, or I guess forget about the stress of the day? Is your anxiety becoming panic attacks? And so, doing what I do 25 to 30 times a day, uh, I sometimes feel that psychology and psychiatry has become a big part of my life. And so I tell my patients that if you have a stressful day and your mind races for a while at bedtime, it's okay to let it do that for a while, but give it a time. Tell yourself, I'm going to give you 30 minutes to worry about what's going to happen tomorrow, and I'll give you, let's say, 15 minutes about the memory of what Dr. Eson told you 3 years ago about you being iron deficient. So don't automatically assume you're nuts or it's psychological. So if you're experiencing significant chest pressure, fainting, severe shortness of breath, the serious stuff, yes, that needs to be evaluated. If you are diagnosed with cancer and you feel depressed and sad and hopeless, that's completely understandable. But if you are anxious and you're having thoughts of harming others or harming yourself, you have to immediately get help. That requires immediate medical attention. So I always tell my patients, which is going to be in the next probably 30 minutes, stop watching the news, exercise regularly, stop driving yourself crazy with social media. You're essentially telling your brain it's time to go to bed, and that basically means you're going to take a deep breath, you're going to relax. It's okay to give your brain a few minutes to digest what happened, but then you tell it to stop. It's just like a dog. Stop thinking. And once you do that, you fall asleep and you can rest and have a good day the following day. The goal is not to be afraid of anxiety. That's the worst thing we can do. The goal is to understand your body is telling you something and recognize what it's telling you. I always remember big stuff like thyroid disease, diabetes, respiratory disease, substance usage or withdrawal cause anxiety, and you need to be seen by a doctor. But half of these anxiety type of issues that I see in my clinic are patients who choose to think about the horror story that could happen rather than the cure that could happen. So if you have an option between watching a comedy and a depressing, awful, scary movie, make the right decision. Life is hard as it is. I hope this has helped you.